So, so welcome everyone. Good morning, good afternoon, good evening, wherever you are in the world. Buenos días, buenas tardes, o buenas noches para todos y todas. My name is Yamitza Villarreal, and on behalf of the Institute of Global Homelessness, I'm very pleased to welcome you to today's webinar. We're grateful that you can join us today for this conversation about national homelessness enumeration. And if you can see my screen moving right now, just a quick note before we begin. I know people are here joining us. So this webinar is being recorded, and we will share the recording with the follow-up communications and the material that we'll be sharing after the session. There's a Spanish and live transcript available at the bottom of your screen. So if you need interpretation to Spanish, please make sure that you activate right now. And I can do this also in Spanish. So, bienvenidos. Si necesitan servicios de interpretación en español, abajo de su pantalla pueden seleccionar la opción en español y van a escuchar la traducción a lo largo de este evento. We encourage you to introduce yourself in the chat, make comments, and share ideas throughout the session. At the end, there will be also a discussion. So if you have questions for our speakers, please add them to the Q&A. That is also at the bottom of your screen. And we are really happy to have with us today representatives from the National Statistics Office of South Africa and Chile, who will share insights from their recent national efforts to measure and understand homelessness through census and data collection initiatives. So we'll be doing that today. You can also stay connected with IGH. Here is our email address if you have questions or suggestions. IGH is also on X, LinkedIn, Instagram, and YouTube. This recording will be available in YouTube if you want to see it afterwards. With me, I have Julia and Tiffany with me, also part of the IGH team, who will help me facilitate this space today. And we want to thank Leslie, who will be our interpreter to Spanish. Some acknowledgements before we begin. So IGH has a diversity, equity, and inclusion commitment. We recognize that homelessness disproportionately affects Black and Brown people and other historically marginalized populations, and we are committed to work and actively working to counter racism and inequities in the homelessness sector. We also want to recognize that IGH sits on the indigenous land of the Council of the Three Fires. To share a little bit about IGH, the Institute of Global Homelessness was founded in 2014 and is based in Chicago, the United States, at DePaul University. IGH is the first organization to focus on homelessness as a global phenomenon, and we particularly focus on people who are living on the street or in shelter or emergency shelters. We divide our strategic lines by see it, solve it, share it, and we work to accelerate progress toward preventing and ending homelessness by drawing connections between research, policy, and practice. In those areas, we advocate for international homelessness policy focused on definition and measurement, which connect with what we are doing here today. Through our Vanguard program, we partner with cities and countries to take concrete action to solve the problem. And we also facilitate spaces like this to convene with other practitioners to exchange knowledge about proven practices and challenges. Now I want to hand it over to my colleague Julia, who will begin today's discussion with a global overview of homelessness definition and measurement.
Thanks, Yamitza. So as Yamitza mentioned, one of our priorities is focusing on global definition and measurement. And across the world, we are seeing an upwards trend of more countries collecting data on homelessness, but there's a large gap that does exist. And one of the issues is that homelessness is not included in the Sustainable Development Goals, leaving a large percentage, a large population behind. And so we're working with our partners at the United Nations, including UN Habitat, to advocate for homelessness to be included in the next set of Sustainable Development Goals in the post-2030 framework. And we're working with cities and countries to improve their homelessness enumeration to get there. For the 2025 Secretary General's report, it did show that there is still a gap, and that it's working to address that, and calling for countries to collect shared to collect data and a shared definition on homelessness. For at the UN, there's been 3 UN resolutions on homelessness, and there's a 4th that's being negotiated right now at the 3rd Committee of the UN General Assembly. And the resolutions include a description of homelessness, which includes 3 broad categories, and it urges countries to collect data across these categories. UN Habitat is working to set a global definition of homelessness through their open-ended working group. And so hopefully there'll be an update about that in 2026, which will include recommendations on a global framework. For the resolutions, they call for member states to collect disaggregated data on demographics related to homelessness, and harmonized measurement and collection to enable national and global policymaking. Collecting data on homelessness is really key to informing programs, have data informed decision making, and it's really key to inform resources and funding. And so every country should have a national count on homelessness, and work to make sure it's an inclusive, working with local partners. And I think this webinar is in support of that, and showing 2 great examples from South Africa and Chile. And so for IGH, we've worked to map the state of global enumeration through our global homeless data map, and show the gaps that currently exist. So this map specifically focuses on official government data, and shows that there are 78 countries that have official government data in some form, but there's not many. There's less countries that have reported in the last 5 years. So only 57 countries have reported in the last 5 years. So there's a need for more current data, and there's a need for us to move significantly up from the 78 countries. But we have seen progress on this front, and more countries are collecting data. So for the global homeless data map, we see different methods of data collection, including surveys, street counts, mixed methods, and estimates. But the majority of the current status of data is from censuses. So 46% of official government data comes from censuses. And what we recommend as far as methodologies is a rigorous methodology that matches the definitional framework of the country. And it should be a consultative process with government ministries, civil society, health agencies, people with lived experience, law enforcement, and community leaders, because we want to make sure that it's inclusive and accurate as possible, and also to collect disaggregated data with demographic information to inform targeted programs. And so we hope that with this work, and with more countries collecting, we're able to make more progress, and able to accelerate the work to prevent and end homelessness.
Thank you, Julia. So it's now my pleasure to introduce the first speaker for today's webinar. Dr. Lutendo Malicia is the Deputy Director at Statistics South Africa. She is primarily responsible for content development and outputs related to national census and large-scale household surveys. Her focus within the census includes developing methodologies and outputs for the homeless population and transit groups. You'll be able to read Dr. Malicia's full bio in the chat. And I will now turn it over to Lutendo, who will share insights from South Africa 2022 National Census on Homelessness. So Lutendo, I'll stop sharing my screen.
Okay, hope everyone can hear me.
We can, thank you.
Is my screen visible?
It is visible. We are just not in the first slide.
Okay. All right. Thank you very much for the opportunity for us to present our work. I am Rutendo from Statistics South Africa as announced, and I'll quickly share how we collect information from on homeless population. In South Africa, at a national level, it is Statistics South Africa that collects that information, and we can only collect it through our censuses. So far in South Africa, we've had about 4 censuses. We've had one in 1996, 2001, 2011, and 2022. In all these censuses, there was a collection of homeless population. Of course, this has evolved over time. We've had changes in methodologies, but we have managed to collect in all our censuses information on homeless persons. My focus of today's presentation will be mostly based on the census 2022, but just to give you a bit of history on how where we started. We've had our first census, a democratic census in 1996, wherein we had only one questionnaire that targeted households, and everybody else was in South Africa, including the homeless. But those in that year, it was just one questionnaire that was used. And then in 2001, we started separating the questions. We've had a question that would look into institutions and such as also tourism hotels, for example, and also would then have a questionnaire that was also would be collecting information from the tourism hotels and the homeless in the same place. So we've had that, and the similar methodology, we had about 3 questionnaires in 2011, wherein we had one also on households, then tourism, and then one that targeted special dwelling institutions. Yes, and then in 2022, we were very specific, especially after consulting with our stakeholders to say we needed a more focused questionnaire. So this was the only census that was really, really clear and went strictly to created questionnaires that was strictly meant for the homeless, and we did that. And of course, there were changes in methodologies. We collected information through CAPI and CATI. It was only in 2022 census. All these other previous censuses, it was paper and pencil, and we still had to come back and process the information. So that's how we have evolved over time. For our censuses are always, and it's a point in time, we take a snapshot. It's a de facto census wherein you have 1 day reference, you have a reference night. So on that reference night, it is the night that we always collect our information from the homeless, because obviously we can't go back and, unlike with households, you can only collect one night. And the whole idea is this population is mobile. You may end up then doing repeating the same person twice. So we have individual questionnaire, especially for the census 2022. So the questionnaire was specifically for the person. So you can't say, in the same questionnaire, you'll be able to collect information about other family members who may be also homeless, but it was specifically an individual questionnaire. And for the census 2022, we had 2 questionnaires, where the questionnaire that was strictly looking for the people who were roofless, and which we call the homeless questionnaire, or questionnaire for the homeless. And then we had another questionnaire which was looking for the special dwelling institutions, such as your military barracks, people who work in hospitals would have accommodation there. But then in that particular questionnaire, we also strictly targeted the people who were sleeping in homeless shelters. So they were collected using that questionnaire. So therefore, it means we had 2 types of questionnaire for the homeless population. And the census 2022, we collected, our census night was in February. And so we collected that on the 2nd to the 3rd of February. Data collection, I think I spoke about the fact that we had 2 questionnaires. So on the individual questionnaire, which was targeting the people who were roofless, it was a very simple and short. The idea is because we only have one night, it can only be short and it needs to be fast. So the target was mostly demographics. So we had about 11 questions in that questionnaire. Ideally, we didn't want to spend 10 minutes with one person because we had few hours in the night. We can only collect in the evening. So we had few hours to ensure that we collect nationwide all the hotspots that were targeted. So we had sections on education, so demographics, which had age, sex, population group, which others will call race, and then we had questions on marital status. Then we also had one question on education, and then we also had migration questions, which were asking people about the provinces where they are born and where the countries at which they were born. And then we also had additional questions on locations and reasons. And then the special dwelling institution, which we are calling SDI questionnaire, it had very few questions. It was strictly demographics because it had other questions that were more at an institution level, asking whether the institution has access to services, for example. So, yeah. And then in terms of the definition has also evolved. For the 1996, 2001, and 2011 censuses, we had questions. The definition was specifically persons who had no form of shelter on census night or non-residential address. And then in the 2011 and 2022, actually, we adjusted the definition to accommodate, it was expanded to include persons who are counted in shelters because we did count persons who were in homeless shelters. So our data was categorized into two groups. We have the group that is people who were roofless, and then the people who were in shelters. Just to add, in the census 2022, we introduced new questions or items in the questionnaire, which never existed before. We had an item that measured the type of location at which people were found. For example, are they found on the streets, doorways in front of the shops and pavements, and then under the bridges, parks, riverbanks, dumping sites, veld, abandoned building of vehicles and encampments. So if the other places that were not there, then the interviewer would then create a new category to say this is not part of the items, which hardly actually happened because we didn't get any new place other than what we had already prescribed already in our categories, which is very interesting. But we also introduced a question on reasons for homelessness. It was the first time in South Africa we were asking this question, and which was very useful. And this was actually a recommendation from our stakeholders when we had our stakeholder consultation to say, we need this because we need to know causes of homelessness in the country. So we measured this and we looked into all these categories, loss of job, no income, whether the person is divorced, drug use, a number of them. So these were the things that we captured. And in terms of just pointing out some of the limitations, we acknowledge that we are not perfect. We are learning, we are evolving over time. But through the process, we hope at some point we would have reached a point wherein we say we have done much better. But as we have mentioned, because of a short time that we have, therefore the information is limited mostly into demographics. It's very few questions that we can only measure in one night. And you are not, in our data, one would not be able to identify the relatives. If a person is on the street and there's them and the child, for example, or maybe siblings are on the street, we wouldn't be able to know because it is an individual question. So even if you try to match the data, you are not able to see families who are existing and who are homeless. So these are some of the limitations that we just acknowledge. If I still have time, I'm not sure how I'm doing. I can just quickly show you some of the results that we had. We had very interesting results. In 2022, we found about 55,719 persons who were homeless. This is including both those who were roofless and those who were living in shelters. And of course, this was a huge increase compared to the SA. As you can see, this shows that the population has been increasing in South Africa. We moved from 13,000 in 1996 and to 2022 to 55,000. So this is what we have found. And just to quickly show you in terms of the areas wherein we found, in terms of the provinces in South Africa, we found that Gauteng is leading. It has the largest proportions of persons who were found homeless, with about 45.6%. And it was followed by Western Cape, which is 17.5. These are like our national economic hubs, and which is more understandable. You know, people obviously go to these provinces hoping for opportunities, and then when things don't work out, people find themselves in these situations. So we also looked at them in terms of the metropolitans. We found that, of course, Gauteng was leading the two metropolitans that were in Gauteng, which is the city of Tshwane, which is the capital, and then followed by the city of Johannesburg were leading. And then only Nelson Mandela Bay had very little people who were found homeless. I'm trying to be as quick as I can in the interest of time, but you can stop me at any time. I just wanted to, the result that we found very interesting in terms of the new items that we introduced in the questionnaire were in terms of the locations where we found that, of course, majority of people who were found homeless were found roofless. That's number one. So the roofless were the majority. Then we found about 20% people in the shelters. And this was then followed by people who were found in the abandoned buildings, and then in the parks, and then under the bridges. I just want to quickly point out issues of reasons of homelessness that were reported. Of course, males are the majority. I think this is usually expected. So I wanted to quickly talk about the reasons. In terms of the reasons of homelessness that were provided, we found that people reported that they were mostly homeless due to the fact that they lost their jobs, and then it was, or they have no job, and then it is followed by drug or alcohol use. I think I'm going to pause it here. I can see I'm running out of time, but if there are more questions, I'll be willing to respond to that. But other than that, I think those are some of the, in terms of measurement, I think I've indicated how we measured and how we collected. So just to emphasize, what we did in the census 2022 is that we went and identified all the hotspots. So we used a new geographic system wherein they had put in points in the areas that were identified as hotspots, because, you know, with digital information, so it was easier for us to navigate to those areas. And these were mostly identified by our district offices, who already know these places and identified them. And then the geography just went and created hotspots. So it made it easier to navigate on the night of the count. Thank you.
Thank you, Lucindo. Thank you for that presentation, for taking the time to speak with us today and sharing some details around the methodology, why some decisions were taken at the moment, and the areas that you're incorporating in the questions, and that the new questions that you added the last census, which obviously shows that there are a few things that you always consider that need to be progressed and need to be incorporated, which is really good. So thank you for that. I think now we'll hear from Chile's experience with the 2024 National Population and Housing Census, which for the first time included a special operative to enumerate people experiencing homelessness that considers people living on the street and in temporary accommodation. So I will now invite Bernardita Sauna Urmeneta. Bernardita currently serves as the National Coordinator of Special Operations in the data collection area.
Thank you very much. Good morning to everyone. Thank you to IGH for inviting Chile to participate in this webinar and to be able to share with you the work that we carried out here. And we'd like to thank all of the participants for joining us today for the webinar. I'm going to tell you a little bit about the methodology and how we carried out our census operation for people in situations of homelessness. This was in 2024, just a little addition. The 2024 census is the first census that has made a complete count of people in situations of hopelessness. In 2016, we did begin to include census questions for homelessness, but it didn't allow us to achieve that true number of the population because we weren't able to survey all of the shelters and find all of the groups and populations. So in 2024, we really went through with it and to be able to get more of a clear number. So the 2024 population and housing census in Chile was the first census that used a de jure methodology, which it means carrying out the census of people in the location of their usual residence. We carried out the census between March and July 2024. For this census, we had more than 25,000 census takers, as well as all of the other operational administrative workers who are helping to facilitate the process. One of the important innovations that we had for this census in Chile was the incorporation of new technologies. It was the first census that was not taken out on pen and paper. We were able to use different technologies with mobile devices and online information tracking. And that really allowed us to be able to carry out a true census of the homeless population as well. In terms of the operations, we can divide it into two groups. We had the regular operations, which we're talking about the 25,000 census takers that are going to particular households, individual households, to carry out that census. Most of the population is, of course, living in private households. But then we've got the special operations, where we look to carry out this census on all of those populations that are not residing in private households. So we have special operations for group housing, or also hospitals, prisons, different types of group or shared households. And then we also have the operations for the homeless population. These special operations do not look to define the dwelling because it doesn't have to do with the private households. Those who are living in group households or in situations of homelessness will only answer the module that is related to individual data rather than household registries. In terms of our operations for carrying out the census on homeless populations, for the effects of this census, we defined it as those populations who lack a fixed residence, who are sleeping in public or private spaces at night, but who do not have an accommodation that meets those basic characteristics of a dwelling, although it may serve that function. Then we also considered all of those people who, at the time of the census, did not have their fixed lodging, and so they were spending the night in temporary housing or shelters. To be able to prepare for carrying out the census of this population situations of homelessness, of course, the objective is to apply the census to all people in situations of homelessness who are living within the borders of the country. But that takes a lot of planning, and we needed to adopt it to the really high mobility of this population. In terms of collecting all of that information, we needed to keep that in mind. And so we also really needed to make sure that it was a census that we would be able to apply at whatever location we found them. And so we took into account a lot of international recommendations and the experience of previous census in different countries. Of course, as we've seen, we also needed to be capable of carrying out this census in a very short amount of time. It's quite a different thing than applying a census to fixed addresses where you can take a much longer time to do it. The 2024 census also had that added challenge of being able to conduct a census of minors who are living in the streets. Taking all of this into consideration, we realized how important it was to be able to work with partnership institutions who have experience both with working with homeless populations to be able to make sure that we could all overcome this really enormous challenge. Our methodology was based on working as a network. 2 years before the census, we're talking about July 2022, we established a national street team which incorporates the Ministry of Social Development and Family and other social or civil society organizations, including the Hogar de Cristo and solidarity organizations. And together, we wanted to take into consideration all of these challenges and look to define how we were going to carry out this operation. First, we defined some technical definitions that we would use to include in the census, how we would define the populations, how we would define the locations where we would find people who are in situations of homelessness to carry out this as a census, and then how are we going to be able to carry out this operation. We also then established some of the guidelines to prepare and how we were going to be able to carry out this work. Based on this work with the National Street Team, we were able to carry that up to the regional coordination level, where we had partners participating from the same organizations from that National Street Team, but we took it up to the regional level, and we sought out local stakeholders from the different regions of the country. We had civil society organizations and regional governments, for example, participating. And that allowed us to really adjust certain guidelines or to be able to adapt everything to the specific regional populations. You have to understand Chile is such a long country. We have so many climatic variations between the north and the south. And so there's quite a different context for all of the population, but especially for the homeless population, due to the different climatic variations that they might be facing and the different mobility of those populations that we might see depending on the time of year. Then we had a community coordination within each region that was more at the local level, where we worked with the different municipalities and other organizations who have a presence at that level. And that allowed us to really get into defining aspects of the operation, the logistics, the participation of different facilitators, or how we were going to be able to publicize the role of street census takers, attract people to those roles. And then we get down to that territorial level, which might be just working within the district. But in our larger districts where we have higher populations, we had our street teams as well, or street territories, we define them, which helped us to organize the whole process, the work that we were going to carry out that day. And when we look at our street territory teams, they started to identify those street points that we took advantage of all the data from the different organizations we work for so that we could see where are all the temporary shelters, where are the hostels, where are the shed houses, where are these populations focused. And so, as you can see on the map, we were able to identify these street territories, these polygons on the map where you can see where we were able to group all of these points, define the accommodations, and use that information to be able to define the routes and the street sweeps that the census takers would like. And so how would we coordinate it? How would they go on foot? Would we coordinate vehicles, for example? How are we going to carry out that census in those areas? We define the teams, we define the vehicles or the routes that they would take, and the dates and times. We needed to be able to identify where these people are going to be sleeping, where you can usually find them very late at night or very early in the morning. There are variations depending on the geographic location of these populations throughout the country. But it was really important to see how our street territory teams were able to work together. And so in terms of our general method of work, we worked as pairs. We had a census taker with a facilitator, or perhaps two census takers together. And we were using it in terms of thinking of how they would relate to people. How were they going to be able to reach everyone that needed to be considered within the census? And so we really had to think about the context. In terms of the duration of our operation, it was a really short period of time. The census itself took 3 to 4 months, but the street operation was only 6 days maximum, depending on the number of street territories that we might have in a single district. It might be 1, 2, or maximum 6 days that we had to carry out the census. So one territory, for example, might be have the census taken in just a single day, depending on the mobility of the population within that territory. The hours would depend on the specific characteristics of a street territory. Usually it was at night. And then the training of our operations teams were taken the week before. So everyone who was participating in the operation had already worked 1 week in training and 1 week of census taking. We also had a manual that we used for these special operations. It included the main guidelines for everyone who was trained on these teams. We also had a protocol for applying the questionnaire to homeless people, and we had specific protocols as well. For example, how to collect the data on children and adolescents living in the streets, or what to do in the event of someone's death during the census. In the 2024, we didn't carry out the census on minors or adolescents unless they were accompanied by a responsible adult. Only people over the age of 18 were considered in the census. Children under that age were only considered if they were accompanied by an adult. So in terms of the operation teams, we had a regional coordinator, then we had the district coordinator or the street or coordinator, depending on the context of each area. Then we would have the team that had the facilitator and the census taker. We have to remember that the work that we did with all of the organizations in advance was so important to be able to make a call for people who had a lot of experience working in the streets to be able to take on that role of a census taker. And then we had a lot of volunteers from different civil society organizations who helped us as facilitators. So those teams working in pairs were really fundamental. It allowed that census taker to be able to carry out their work, but we also really needed that prior experience of the facilitator. In terms of our collection methods, we had those street points where we carried out interviews. We were able to make use of mobile data capture devices, and we did that throughout the country. We also were able to carry out a daily monitoring and follow-up of the operation with our regional teams to be able to see how we were covering everything. We could see our progress and plan for the next day. And we also had digital questionnaires so that we could understand the number of questionnaires that had been completed on a daily basis. In terms of the resources that we had, we made a lot of promotional material that was directed specifically at this population. We had posters and flyers, for example, that were focused on the population. We really tried to publicize this for organizations working with people in situations of homelessness, as well as the people themselves. For example, we would put up posters in different shelters or in health centers, soup kitchens, that sort of thing. We had a lot of food and drink. We were able to provide those people who were answering the census with food and drink when we registered them for the interviews. For example, if we gave them a coffee, that was really welcomed by the people who were completing the census for us. When we began our previous visits, we also made sure to provide those food and drinks as well. Then we also had a census card. So what this was is that each person who filled out the census, we would give them a card that showed they had completed it. It was the same that we gave to any other household. We also made sure that our team were using the same equipment. They had a reflective vest, they had an ID with their credentials. We also would provide them with a backpack for all of their equipment, waterproof jacket, for example, if they would need it. And then we had those mobile devices that were really fundamental. And in those areas where we need it, we had vehicles that would provide our teams with security and help them to reach difficult to access territories. You know, there were some areas, for example, that were quite far removed from urban centers. In terms of our lessons learned, here I've just included sort of 3 big recommendations or takeaways that you might want to consider for any statistical organizations that are looking to carry out their own work. First, having that collaborative, multi-level coordination strategy was fundamental for ensuring the effectiveness of this work. It would have been impossible to carry out this operation without those collaborative partnerships that were direct with different organizations, for example, civil society organizations and also public organizations. It was so fundamental. Secondly, having those street territories, that work of that planning that we were able to do, that was absolutely fundamental. We structured everything based on these street territories teams and worked with different organizations. And it really allowed us to make sure that we had no omission or duplication of data of people being registered within the same day. Then we had this card that we gave to everyone who completed the sentence. It seems like nothing very important, but actually it was so important in terms of being able to give all of those people who completed the census that sense of belonging. And it adds a lot of legitimacy to the process. It also just helped us to verify those who'd been registered already. If we look at some of the results from our census, thanks to all of this work that we carried out, we already have some results. From 2024 census, we found we have 21,750 people living in situations of homelessness. This is 0.1% of our population. The average age of our homeless population is 43 years old, which is older than our average national age, which is 38. It is, of course, mostly men. We're looking at men who have an average age of 43.9 years old versus women who are 38 years old. In terms of some of the characteristics, based on the questions in our census, we were able to gather data on those people experiencing homelessness who are from other countries. For example, 13.6% are international immigrants. Those who, if we look at the greater population of Chile, it's actually only 8.8% of the population of Chile are from other countries. We could also look at the percentage of people who have a disability. In the homeless population, it's 29.8%, but in the greater population of Chile, it's only 11.1%. We could also look at the difference between the number of years of education that this population have. We're looking at 17%, sorry, 9 years of scholarization among homeless people and 12 years among the general population. Here, there are some links to the census report that will tell you a bit more about the general process. Then we've also got the dashboard, the indicators. And we have a presentation that tells you in detail the results for the homeless population. And then finally, the last link is for the general statistics that we were able to take on our population as a whole. You will be able to find the results at this link. And you can download some of the tables and additional documentation. So thank you very much for listening.
Thanks so much, Bernadita, for that great presentation. I think it really underscores your work to work comprehensively across all regions, work with government and civil society partners, and work to make sure that the census collectors had a real knowledge of people working on the street. So thanks so much for that presentation. We have time for a few questions. So if you have any, please put them in the chat or in the Q&A, and we'll make sure that they're proposed to our great speakers. We did have a few answered already. So Angeles, who was part of the street team for NHLA, asked a question to Lutendo about the percentage of people living on the street that were in representation of the national population, and Lutendo responded that it's a little less than 1%, but the current worry is that it's increasing over time. And she also included the clarification that street homelessness is included in the national housing deficit. We did have a question, which I'm going to ask both of our speakers to kind of give a little more detail about did the census count of homeless include rural or peri-urban areas, and how was kind of street homelessness in informal settlements treated, or what was that kind of part of the methodology as well? So Lutendo, would you be able to kind of provide some background first?
Yes, thank you so much. Well, in terms of, you said peri-urban or rural, I'm sorry. So
rural and peri-urban.
Yes, yeah. In terms of rural areas here, especially in South Africa, we haven't seen much of the homelessness, because obviously people tend to go to the towns or cities trying to find opportunities. And I think also because of cultural issues in South Africa, obviously if you're in rural area, people are very traditional and we have a way of protecting. So you may find some sort of hidden homelessness, a person maybe who doesn't have a home but would be living with relatives, for example. But all our field workers ensured that they identified areas, because these areas would be known, especially by social workers if they exist. But to be honest with you, in our data, we did not find that. These were mostly found in towns, because people attend to, that's where they find opportunities, small jobs. So the areas that were mostly identified were in towns. And I think it is rurality has to do with the fact that we are very cultural people. And in rural areas, people, even the chiefs wouldn't allow that to happen, wouldn't allow anyone to just sleep outside. They would be attended to. So in terms of informal settlements, people who live in informal settlements here in South Africa are not counted as part of homeless, because the census, they are counted as households. So they are counted as part of the households because they'll be living as a household in it. So they're counted and also, but that data is available. So if you are looking for information that is dealing with people who were found in informal settlements, and they are quite large, they grow. Settlements, informal settlements here grow literally every day. There are new settlements every month. So we have a lot of work here to keep updating those areas. But other than that, yes, they are captured, but they're not captured as homeless in South Africa, but they're captured under households.
Thanks for that clarification. And I think it also shows the importance of, setting that national definition to really have the clarity for the count. Bernadita, if you could provide some more background about how Chile approached the rural and peri-urban.
Yes. In Chile, the homeless population is also concentrated in urban areas, but we were able to conduct this census in rural areas. It was so essential in that work to be able to identify these people ahead of time. And so all of that work that we did ahead of the operation with different organizations and partners to find where would we be able to find these people who are experiencing homelessness, how could we organize ourselves to make sure that we reach those people, that was so important to do that work. The majority of the population, yes, is in urban areas, but we were able to reach those people who are in rural areas as well.
Great. Thank you. I think that shows really the importance of doing the preparatory work to understand the population and work with participants to understand the incidence of homelessness in rural areas. We did have a question, which I think we have a lot of resources to follow up on about. Do you think providing shelter to homeless people is the only solution to homelessness? And I know that, like, for the Ministry of Social Development and Families in Chile, they have a Housing First program, and they have programs to work with different populations. But Lutendo, you were shaking your head, so do you want to come in here and provide a response?
Well, I don't think it's the solution. Well, I think if you look into the reasons that are provided, people are finding themselves in these situations because of the fact that they don't have jobs. So if we were to address the root causes mostly, I think if there are opportunities or programs that will keep people busy and they are able to make some form of income, then they would be able to provide some sort of shelter for themselves. So I think, yes, it does help temporarily, but we need a long-term solution, something that could sustain people. And I think that's where the policies and the policymakers need to focus on. Yes, not that they shouldn't do. We don't need people in the streets. Obviously, it's unhealthy. It removes dignity. But we need to make sure that we do. In the meantime, as we're doing that, let us also address the root causes that are causing. Because if you saw in South Africa, majority of people were saying it's because I lost my job, it's because I do not have employment. And if we have programs that are addressing that, then we shouldn't have this problem.
Thank you. I think, having prevention initiatives, affordable housing programs, and then working to support people so they have, a real livable wage is so important. Bernadita, did you want to come in here?
En el caso del censo.
In Chile, I think with the census, we haven't been able to look at this from the statistics. We have to work with all of our policymakers and different ministries to be able to take those data and develop all of those elements. From the statistics agency, we can't answer those questions precisely.
Yes, thank you for, but I think also that, that shows the importance of connecting with the Ministry of Social Development and other agencies for them to kind of use the data to inform solutions and have that connection. So there's such a connection there. I know we're almost out of time, so I think Ali wrote in the chat about why was the point-in-time methodology chosen over others, and I think for the census, there's an importance of representing the homeless population in the overall census and to really show that population. But we do stress the importance of using mixed methods, and so using administrative data and other data to come in there to really have a full representation of the count, and to have services and prevention work to understand those drivers as well. So I think improving methodologies over time and understanding that is so important. But thanks so much for your participation and your answers. And I'm going to turn it over to you, Mitza, to close the webinar.
Yes, thank you to both of you, to everyone that is engaging in the chat. If you still have questions that you want to have answers to, you can always share them in our community impact group that we have in LinkedIn. We are going to make sure that the questions that you're sharing here today and that have not been answered in this webinar will be answered in that group. So you can find the link in the chat. I know my colleague Tiffany is sharing that information. And also, as a final announcement, we want to communicate that IGH just launched on its website the homelessness methodologies. It's an introductory guide that brings together all the global approaches and methods that countries and cities have been using to enumerate homelessness. You can find introductory information about census, point in time, and what these methods implicate. There are some examples that you can see, what countries are using them. So we want to also share that in the chat. I know there's a link and will be part of the follow-up communication that we'll be sharing. So I want to again thank Lutendo and Bernadita for taking the time to be with us today. Thank you everyone for participating and attending this webinar, and we'll be sharing the recording and all the related resources with the participants. Thank you again for being here.